today. It is Monday, 12 April 2020.
In January and February, the world saw 6 consecutive weeks of declining cases. We have now seen 7 consecutive weeks of increasing cases and 4 weeks of increasing deaths. Last week was the 4th highest number of cases in a single week so far.
Christian Lindmeier, and welcome you to today's global COVID-19.
Make no mistake, vaccines are a vital and powerful tool, but they are not the only tool. We say this day after day, week after week, and we will keep saying it. Physical distancing works, masks work, hand hygiene works, ventilation works, surveillance, testing, contact tracing, isolation, supportive quarantine, and compassionate care. They all work to stop infections and save lives.
Official UN languages, Arabic, Chinese.
Right now, intensive care units in many countries are overflowing and people are dying. And it is totally avoidable. In some countries, despite continuing transmission, restaurants and nightclubs are full, markets are open, and crowded with few people taking precautions. Some people appear to be taking the approach that if they are relatively young, it doesn't matter if they get COVID-19. This disease is not flu. Young, healthy people have died, and we still don't fully understand the long-term consequences of infection for those who survive.
Portuguese and Hindi. Now let me introduce.
This pandemic is a long way from over, but we have many reasons for optimism. The decline in cases and deaths during the first 2 months of the year shows that this virus and its variants can be stopped. With a concerted effort to apply public health measures alongside equitable vaccination, we could bring this pandemic under control in a matter of months.
Very much, and this was Dr. Soumya Swaminathan, Chief.
When in addition to scaling up immunity through vaccination, we reduce transmission, which also reduces the likelihood of having emergence of variants that could escape from vaccine-induced immunity. So this is just, again, a reinforcement that we have so much hope and desire to get on with more regular life as people become vaccinated, but it's actually the opposite. It's the very time when we should be as diligent as ever. There are no data at this point on any mix and match regimens, although certainly there probably are individuals around the world who have had a different product than for their second dose than the product that they had as their first dose. We really welcome studies that would look at mix and match regimens because clearly from a supply perspective and also from a programmatic perspective where many countries have more than one and some countries up to 3, 4, 5 products in the country, it would be very valuable to have these kinds of data to inform how best to use the vaccines.